count all the minute meridians. So if you think about the capillary system and our, our veins and arteries as the major highways of blood transporting, there's the miniature wave, the minute channels, the capillaries. So if you consider everything, all the meridians, there's 72,000 meridians. But there's 12 main meridians, and those are the ones where the acupuncture points lie. And then there's the two that I mentioned that are on the central channel and governing channel. So in general, the channel network is what supplies the entire body with qi and blood. It protects the body from the climate factors. The meridians, they respond to dysfunction in the body. They send qi and blood to diseased areas. They remove blockages, adjust metabolism. Basically, they're doing everything. And they're connecting the dots of all of these hundreds of tiny little reservoirs of where our qi and blood pools. That's what the acupuncture points are. It's little places on the body that you can very much feel. Like if you're, again, it's pretty sensitive, but if you know what you're feeling for, a lot of times an acupuncture point will either dip in a little bit or it will be raised. So that usually means that it is either deficient or it's excess if it's raised. There can be thermal changes. It can be hot or cold. It can feel like there's not much there, like it's not. It's almost like it's spongy, kind of, where it needs to be a little fuller. So there are a lot of different ways you can feel the points. Of course, you learn where they are as an acupuncturist. You learn in many different ways exactly where the points are located. But then ultimately, you do have to feel them, because the interesting thing is the points can move a little bit. So even though we do have a textbook definition of exactly where that point is located, we start there, but it's just slightly this way for this person, or that way. So basically, yeah, the points are places where the qi and the blood are gathering. So they're perfect places where we can affect change. We can go in with sterile, single stainless steel needle, very fine, which I'll show you tonight what they look like, and just affect the qi in whichever way it needs to be done. Adjusting the dynamic. Basically, they're usually all stainless steel. Sometimes I use gold needles. So those are very strongly tonifying. So sometimes I use gold. Let's see. And one thing I thought to mention too with acupuncture, that you can stimulate local sites on the body to have a global impact on the whole body, or you can, similarly, you can do many points around the body and it'll have a specific outcome in a local area. So, sometimes people come in for knee pain and I might not necessarily put a needle right in the knee area, it might be in another spot, and they wonder, well, why aren't you putting a needle in the knee? Because it depends. Sometimes it can be more effective to needle distally to the point, distally to the area, So it just depends. Especially if there's a recent trauma to an area, it's much better not to needle in that area, but to needle distally. And also because this whole thing about you can stimulate a local area and have a global impact and vice versa, that's why a lot of times acupuncture has these secondary impacts that you don't really realize that you'll have. Which is why I always remind people coming in for a session that even though they're coming in for their migraines, we can treat their constipation at the same time very easily. Because, well, for one, this whole idea of holism, we're treating the whole person anyway. So we have a diagnosis for that person at that moment. And so definitely, and secondary benefits, they're expected. People, it's just that's part of it, always you feel pretty blissful and happy after acupuncture, almost always. Everyone always reports they slept better after acupuncture. They had more energy, and it's cumulative. So the more regularly you do it, the more you feel it. Just like anything, like a training with meditation or with Tai Chi, it just gets more as you do it. Similarly with acupuncture. As once you're getting your body more and more in balance and you're keeping it that way, of course you're just going to feel good, right? So, in a very general way, sometimes people like to know the scientific aspect of what acupuncture is really doing. In one way, it's just really improving circulation. We're like adjusting that flow of qi and blood in the body because we're increasing circulation, that's directly why it's helpful for inflammation, swelling, pain. That's one of the reasons. Another reason it's helpful for pain is because just by virtue of receiving acupuncture, it releases endorphins from the brain. And endorphins are related to decreasing inflammation and pain, as well as that blissful feeling that runners experience, because when they run a lot, they get a lot of endorphins. Acupuncture naturally brings those into the bloodstream. So people feel happy and their pain is less. Another thing is basically it has this overall balancing effect, so it promotes this homeostasis. So that's why, again, you just kind of feel more balanced. You know, some patients will tell me, like, they come in feeling out of whack, whatever that means to them, you know, and they leave just feeling more like themselves. So it just has that ability to, the body knows how to heal. That's another thing that I wanted to say in the very beginning, but it's amazing. We have an amazing, remarkable ability to heal. The body knows how to do it, and acupuncture is just one of the ways that we can use to kind of tap on the shoulder and whisper and say, this is what, it's just a little reminder. Here we go, like, do like this. Oh, right. And then your body knows what to do. So, all right. I think maybe I'll stop there and we'll do a little demo. But if you have some questions, this would be a good time.
Well, this is an important question to me, and maybe a lot of them, when you were talking about the meridians and all that. I heard this at the first ashram I was at like 15 years ago, but I've never heard it since, but I have a feeling it's true. See, I love dark chocolate. They said it like blocks the micro